Close to the due date, you might already know which hospital you will be going to. Some women choose a hospital close to home since the baby could arrive at any moment, and you want to reach the hospital quickly. Some hospitals provide prenatal class or orientation session to explain details on what to expect during the childbirth. It should be noted, when pregnancy is high risk, the obstetrician might suggest staying in the hospital prior the due date to better follow up and to avoid any risk. If your delivery is a planned C-section, then you will have a predefined date. Once at the hospital, women need to address to childbirth department to see a nurse for the triage. A nurse will do the initial evaluation to determine if you already started labor or you just have mild contractions known as Braxton Hicks. If the labor has not started yet, you will be sent back home and need to return later on a more advanced stage. If the labor started, with regular contractions, you will be placed in a birth room where you will be evaluated further by healthcare staff. Note that some hospitals are teaching ones, therefore, medical interns or practicing doctors will come to see you. You will stay in the birth room until the baby is born. Nurses will regularly check contractions monitors attached to your belly. They will be telling you how far you got into the labor as well as read your baby heart rate and oxygen saturation. They will also encourage you and speak to you all the time. A future mom has a choice to request an epidural to have the labor less painful, based on some health criteria, stage of labor and a nurse judgment. Most of the women get it upon their request, but a consent document must be signed. During the labor your relatives can be with you all the time but usually only 2 persons. Adults are allowed in the room. If you have children, you must request someone to care for them. After the baby is born, you will be transferred to semi-private or private room depending on your insurance and room availability. Usually, after a non-eventful childbirth, mother and baby stay in the hospital for 48 hours. If there are any medical issues or the baby was delivered via C-section, the period of hospital stay will be longer. Both mother and baby will have regular checkups by nurses and the first pediatric examination by a doctor. They will also take screening blood tests and provide some basic training on how to handle the baby. If you were working when you became pregnant, you have to provide a notice letter to the HR of your employer where the dates of your maternity leave and potential return day. Some companies provide extra days or short-term disability as benefits. Verify with your company. What are your rights according to the Canadian law? According to the Canadian Charter of Rights and Freedom Act 1982 and Quebec Act applied to health and social services, any person should receive the same care secured by the government responsibility to provide health care services. Therefore, a woman in labor presenting herself in a hospital cannot be refused by the medical staff. Doctors have an ethical and legal obligation to help people in life-threatening circumstances. Moreover, there won't be any discrimination based on race, religion or the language you speak.